All right, Adam, I think we're probably good to start now.
All right, this sounds
Yeah.
great. All
All right,
right, well,
I can give a quick intro right now as well.
sounds
Yeah.
good.
So, hi everyone. Thank you for coming to the third installment in our AI Talk series. And today we're joined by Dr. Adam Andersen, who's a clinical assistant professor at the UIC School of Public Health in the Policy and Administration Division. And today he'll be teaching us about AI application in healthcare practices. And without further ado, this is Dr. Adam Andersen.
All right, thank you, Juju, for that introduction, and thank you for inviting me to this talk. And thank you to the rest of you for joining. As Juju said, I work at UIC. I'm a clinical assistant professor in the School of Public Health. And my research interests are in applications of AI in healthcare practice, and really more specifically, how to measure and promote AI literacy among healthcare professionals and students. So that's kind of the next phase of my research. But for the next 30 minutes or so, I want to walk you through an introduction to AI in healthcare and then share some of the findings from my research so far. So just to look at an agenda, I want to first share a little bit more about my background, how I got to this point, and then walk through a kind of like a high level introduction to AI in healthcare, talk about the different healthcare data types that are used to train models, and then talk about some more recent healthcare AI applications that are already in use in the real healthcare industry. Then also talk about the ethical concerns around AI use in healthcare. And there's a lot of concern with those. And then I could open it up to any questions that you all may have. So really quick, just to talk a little bit about my background, I think the best way to describe my career is in different chapters. So I've had three kind of main chapters of my career. My first chapter started as a clinician. So I worked as a physical therapist for 14 years. I specialized in orthopedics, went through residency and fellowship training in orthopedics. I earned my doctor of physical therapy, and I really loved being a clinician. And I got a chance to lead improvement projects in the departments that I had worked in. And that really was rewarding. And that was something that I wanted to further, kind of grow with. And I decided to bring that sort of my clinical background and my desire to make healthcare better and help patients achieve the best possible outcomes into a full-time quality and safety role. So I transitioned to University of Illinois Hospital and grew into the director of quality performance and improvement. So that role focuses on working with the different clinicians of the hospital to ensure the best possible outcomes and make sure we're avoiding preventable harm. So if you think of like having a surgery, avoiding complications such as blood clots or infections, things like that. So I worked very closely with physicians, nurses, pharmacists, and other healthcare professionals to work on projects to do those sort of things to make sure patients had the best outcome. I also, during that time, earned my Master of Business Association with a concentration in analytics. And this is when I got very interested in healthcare data. And I got more training in statistics and got some exposure to machine learning. So that kind of started my interest more on the data side of healthcare and eventually led to AI. I also worked for a company called Vizient. I'm guessing a lot of you haven't heard of Vizient, but Vizient is a national healthcare performance improvement company that sort of acts like an advisor to different hospitals around the country and shares a lot of data insights with them. So it's a very data-driven company. And based on, that kind of experience, I got more and more interested in teaching. And during that time as a quality and safety leader, I started teaching part-time in the Master of Healthcare Administration program at UIC. And I enjoyed that so much that I had an opportunity to join that program full-time. And that's where I've been the past 3.5 years. And starting in that new role, I also wanted to pursue a PhD because I knew I wanted to do some research, and you really have to do that PhD to get that research training. So that's been very rewarding. My concentration in research is focused on AI literacy, measuring AI literacy and promoting it, as I said. And I'm really passionate about improving healthcare and using that research to help improve healthcare. And I also want to shout out Dr. Yu Yin, who is my PhD advisor. So why don't we start off with like a big picture introduction to AI in healthcare? And I think with the other guest speakers, you might have gotten a sense of what AI is. So I'm going to keep it pretty high level and not get too much into the weeds. But I think some key AI concepts to think about is first datafication. So this is the process of turning everyday interactions, behaviors, and information into data. And to think of a health data example for this is a smartphone, right? The smartphone, if you want, can collect information about how many steps you've taken. It might be able to take your heart rate if you have a watch or other device that can measure that. It can affect how you're sleeping, again, with a watch or other device. There's a lot of different streams of health data that can come from a device such as a smartphone. And then if we take that one level up, right, billions of people own smartphones. So this equals billions of data points that different data scientists can work with. So this concept of big data is now a real thing with the digitization of everything, right? And that massive scale of data collection really has amazing potential to generate insights, make predictions, and help with better decision making. And it has done that in many cases in healthcare and other applications and other use cases. And one example of big healthcare data is all of the information from electronic health records. So I'm sure you've all seen the doctor, and when you go see the doctor, they're usually entering in information into the computer. And the electronic healthware is the software that collects all of this information for your specific medical history and everything they did with you. And it also includes your demographic information, how old you are, where you live, things like that. It also includes all these different notes about patients. It includes test results, right? And it also includes billing data, like what was billed for that visit. So there's a real rich depository of data in the electronic health record. And if you look to the right, in the early 2010s, that's when electronic health records really came online and really scaled up. And you could see that amount of healthcare data we have just through 2020 has really increased substantially. And every year had increased 48%. So I'm sure that number is even higher in terms of exabytes, which is 1 billion gigabytes. So we probably have even more data now than we've ever imagined was possible. So what can we do with this data, right? Now it's like it's an exciting time since we have so much data. So those are the next concepts I want to talk about. So the big data can be fed into models and algorithms, and combined with computing power can really generate some interesting insights, right? And these models and algorithms, I'm sure you've heard about these. These are mathematical functions where you usually have a series of inputs or predictors that can help determine what the output is, or better predict what a specific output is, which might be a disease, or how long somebody may live, or any other thing that you can think of in healthcare. So that's like sort of the next phase. All of this data is fed within these algorithms. And then if you can have something make sense of all of this data, this can be deployed then into AI applications such as large language models, image recognition software, disease prediction software. Again, all of these things are starting to happen now in healthcare, and I think it's a really interesting time. And then at the bottom is the thing we can't forget about, right? Is how do we put up those guardrails to make sure that AI is safe, that it's properly regulated, and it's used in an ethical way, right? And I think a good metaphor for all of this is this idea of a car, right? So big data is the fuel of AI. Without data, you can't really have AI, right? That fuels the engine of AI, which are these models and algorithms and computing power, which can generate all of these interesting insights. And that can then be deployed into applications, right? So the car represents the vehicle for AI. But then you cannot forget about the human element, right? You can't forget about the driver, right? The guy with the seatbelt on that represents the human oversight with AI and making sure that it's properly regulated, that it's safe, and that it's ethical. So I think this kind of works. I'm working on the best way for people to understand how all of these different sort of concepts come together. And this works good with an internal combustion engine car, right? Because you're not using fuel for those EVs. But that's something I think that helps kind of like bring all those concepts together. Now, we think about healthcare and AI. Healthcare provides an essential service to individuals and communities, right? Healthcare saves lives. It can improve people's lives for the better, and it provides a basic human right. At the same time, we know that healthcare has many challenges, right? It's very expensive, it's inefficient, there's a lot of waste, there's a lack of access. So, depending on where you live or what insurance you have, you may be limited in your options. It can be unsafe. There are errors that happen in healthcare because it's a very human industry. And we know that there are workforce shortages as well, right? There may not be enough doctors or nurses. And again, depending on where you live or what your insurance is. And healthcare is a lot of things, right? It's very important, but it has these challenges. And I think at the end of the day, I think healthcare is not unfixable, but it needs the right combination of things to help it get better and improve. And I think, if you think of that car metaphor, there's a lot of different AI applications that can be applied in healthcare. And these vehicles for AI may be part of the solution for all of these challenges that exist in healthcare right now. So I think that's something to think about as AI progresses. Can AI really help with the many challenges that healthcare has? And I think that is definitely what we want to see with this new technology. Okay. Now, if anyone has questions as I'm going along, just feel free to raise your hand or anything like that and try to keep track of everything. Look at the chat. So I think we're good. All right. So so with that introduction, I also want to put it out there that, in many ways, the AIification of healthcare is already underway. There's already applications that are already being used in a real world healthcare context, and many of them have been FDA approved and they're being used in everyday practice. One example is diagnostic image recognition. So if you think about X-rays or MRIs or CT scans and other imaging that's used in healthcare to help diagnose a disease, there are applications for certain diseases or certain images that are now being fed into AI models and then helping the healthcare professional, not miss anything or maybe flag something for further workup or help that professional, that healthcare professional, make that diagnosis or confirm it. So it's still a very human AI sort of interaction. And at the end of the day, the human and healthcare professional is making decisions, but it is playing an important role now with certain diagnostic imaging. The next example is ambient listening for documentation. So I don't know if any of you have noticed this, but some doctors are starting to use a device that records the conversation between the patient and themselves. And that recording can then be made into a structured medical note. So that what that does, it makes sure that the provider doesn't miss anything when they're having that interaction with the patient. And it also cuts back on the time that a provider has to spend during or after the visit to document what happened in the note, because that's required for all medical interactions and treatments. So there's a lot of benefits to this. It can improve the accuracy of documentation. It can reduce the time a provider has to type into the computer. And then also it can increase the amount of face-to-face time a provider has with the patient. So this is a new sort of application that's starting to spread actually very quickly in healthcare. The last example is EHR applications, which I'll talk more about later in this deck. So this is, just something to be aware of, that AI is already being deployed in healthcare, and I think it's a really interesting thing. And it's in many ways it's being embraced with some cautious optimism, we'll say. All right. Now, the next thing I want to talk about is all of these different data types that are available in healthcare that help train AI models. So there are many different healthcare data types. We talked about diagnostic imaging is one. There's a lot of data in the electronic health record that we talked about. There's biomarkers and laboratory tests. If you ever gone to the lab after you saw the doctor to get your blood drawn, and then it's assessed for different biomarkers and like cholesterol or your CBCs and all of these different tests that they can measure to make sure you're healthy can then provide data to train models. You have vital signs. So that's things like heart rate or respiratory rate or blood pressure. And then you have genetic markers. So that's like DNA testing. So there's a rich amount of data with DNA testing. And then something that's been more newer in the recent years is wearable device data from an Apple Watch or other wearable devices that can then be collected. That data can be collected to potentially train models. Now, I see a question in the chat. Uh, does the application of AI in image recognition reduce demand for doctors specialized in this field? That's a really good question because, to my knowledge, there has been no reduction in demand for, let's say, a radiologist who is the sort of main specialist that interprets medical imaging like X-rays, MRIs, CT scans, etc. But my guess is in the future, there may be a reduction potentially because these apps are getting much more accurate. Maybe you don't need as many radiologists, but to my knowledge right now, there is no reduction in demand because that end user, the radiologist, still has to make the decision, right? The AI isn't making the decision for them, but what it can do is reduce the workload, right? Where it's if they need two reviewers for certain images, maybe it can just be one reviewer and AI instead of two. So it can allow the radiologist to spend, more quality time. But I think it is something that may eventually reduce demand. I think that is a possibility. So that's a great question. Um, so these are the different healthcare data types. And there's probably other ones that I'm missing here, um, but I think what this shows you is there's actually a lot of different data that can be used to train models in healthcare. And this data has been digitized for many years now. So there's this huge treasure trove of insights that maybe can be gained from all this data. So now in the past year, I worked with my co-authors, and I'd like to shout out Juju. He's one of my co-authors, to review all of the different reviews that have been done focusing on applications of artificial intelligence in healthcare practice. Now, a review of that is sort of an example of a review is a group of authors. They're focusing on, let's say, an orthopedic disease and like how X-rays can be use AI models to help diagnose fractures or something like that. There might be 30 or 40 articles about that investigating how AI can help fracture detection. And what a review does, it aggregates all of that and synthesizes all of that information, all those insights into one paper and makes some sort of general statements about the state of fracture detection in orthopedics. So all of these different review papers focus on different specialties in healthcare, different diseases. So what we did is we did a review of those reviews. We call that an umbrella review. And with that, we got a really good idea of the landscape of AI applications in healthcare on a broader scale. And that's really helped me understand where healthcare is going. And we've seen some really interesting trends. One trend is the data types that are typically used to train AI models. And you could see diagnostic imaging was the leading type of AI model training. So that means those X-rays, MRI scans. That's actually a very, very rich data source to help train AI models. And that's for a few reasons. But you could see below diagnostic imaging, electronic health records are a popular data source, biomarkers and lab tests, and then kind of down the line. Those top three comprise about 80% of the different uh, data types that can help build AI models. So if we think about diagnostic imaging, as I said, there's a lot of different types of diagnostic imaging. There's X-rays, CT scans, MRIs, and then there's also lesser known images such as retina fundus photographs, which is used in ophthalmology or eye disease. There's skin lesion photographs, which is used in dermatology. Then there's specimen slide photographs from biopsies, things like that. That's used in pathology. Now, what makes diagnostic imaging data special is that it's benefited from years of digitization, right? It's all digitized now. We're not using film or anything analog, right? So it's a digital image, right? And it's also very standardized. Like when you get an X-ray at the doctor of your hip, they do certain views, right? They do a front to back view, they do a side view, maybe a diagonal view, and it's all very standardized. So it's consistent. Like if I get a hip x-ray, the next person that gets a hip x-ray, it looks very similar, right? Because they set it up in a standardized way. Because it's so standardized, it can be easily machine readable, right? Because it's like a standardized image that can, look like the same image over and over again, right? But then it can show abnormalities or it can look normal, right? Depending on what a radiologist or specialist determines. So they can label these images like this is a normal x-ray, or this x-ray shows moderate arthritis, this x-ray shows a fracture, right? These images can be labeled with other markers. And again, all of that data can be fed into AI models, and you can develop predictive capabilities to detect certain abnormalities. And again, if you think about how many x-rays there are available, there's millions of these images. So that the power of these AI models is really amplified because these data sets are so large. And now I'm just looking at the chat. Oh, okay, good. Nothing there. So, so where has this been applied? So I mentioned retina fundus photographs. Now this is, again, unless you're an ophthalmologist, this is not something you think about, but it's possible that some of you had this photograph taken of your retina. And the retina is an extension of your central nervous system. So it's this bowl-like structure that sits in the back of your eyeball, and that takes in all of that visual information that you're taking in from the outside world. And the retina attaches to your optic nerve. This is your optic nerve there. And that goes back to your brain, and that's where all of that processing happens for all of that visual information you have. So the retina is a very important extension of that optic nerve because it's the sort of start of the nervous system and bringing back that information to your brain. The retina can be diseased by different diseases, the most common one being diabetes, right? So if someone develops what they call a diabetic retinopathy, that can lead to visual impairment, it can lead to blindness, it could lead to a detached retina. It's a pretty serious condition that can develop. Now, if we look at all these different photographs, we see different like versions of the fundus, right? This is a normal retina fundus, okay? There's the optic nerve, there's the macula, I believe, all these blood vessels. Again, I'm not an ophthalmologist, but this is what a healthy one looks like. And then as you go down the line, there's different stages of diabetic neuropathy that, again, all of these photographs, again, it's very standardized how it looks. So if they get labeled the right way, if they get fed into an AI, they can potentially detect ophthalmic disorders such as diabetic retinopathy. And they may be able to detect non-ophthalmic disorders or non-eye disease, right? Depending on things that we wouldn't never even think of. Okay. So what's cool about this is that this has been deployed in real world settings, right? There's several diabetic retinopathy tests based on retina fundus photography that helps predict or detect diabetic retinopathy, which can then be assessed by an ophthalmologist, right? So it's not finalizing the diagnosis, but what it does, it alerts primary care doctors to potential issues with their eyesight. And then the referral is made for the ophthalmologist for further testing. But let's take a look at this video so you get a sense of what some of these models do.
Introducing the iArt AI system for autonomous diabetic retinopathy testing. The iArt system is FDA cleared for use in primary care and eye care settings, provides results within minutes of the patient's arrival, and does not require an on-site eye care specialist. It is reimbursed by Medicare and Medicaid, has been used globally on 5 continents, and has analyzed over 2 million images. First, a patient encounter is created, where the patient's name and other demographic information are entered. Then, 2 retinal images are captured from each eye. Dilation is typically not needed for most patients. Next, the retinal images are submitted for analysis by the iArt AI engine, which produces results in less than 30 seconds. These results are presented in a PDF report that provides eye-level results indicating the presence or absence of both more than mild and vision-threatening diabetic retinopathy. Learn more about the iArt AI system at www.inuc.com.
Right, so yeah, that's one example about how diagnostic imaging is already being deployed as a AI model in practice. So that interpretation of the imaging is being automated by an AI model, and then flagging any concerns to that primary care doctor or optometrist. And again, if there's issues, then they're referred to the ophthalmologist. My brother-in-law works as an ophthalmologist, so he told me more about like what are the next steps. It's not just making a final diagnosis, it's alerting that primary care doctor or optometrist to make the referral to the ophthalmologist. So very interesting stuff. And now the next thing I wanted to talk about is other applications of AI in healthcare practice. One example, again, from this umbrella review that we did, was all of the different diseases and conditions that have been studied from these reviews. And you could see the top 2 are cancer and heart disease, which actually makes sense because these are 2 top causes of death across the world. So, of course, these diseases are of big interest to AI researchers. And right below that is infections. Infections are a major cause of illness and potentially death across the world. So there's actually a lot of interest in how AI can help with infection prevention or earlier detection of infections. Now, if we think about the hospital setting, there's unfortunately a lot of different infections a patient can contract while they're at a hospital. And these are called healthcare associated infections, or HAI. Just to kind of briefly review some of these, one example is a central line associated urinary tract infection. So this is an infection of the urinary tract that is associated with a catheter that maybe is left in too long or maybe not appropriately maintained or cleaned. Another example is central line associated bloodstream infections. This is where a line is permanently, or not permanently, but for several days or weeks, placed in a patient's vein or artery that delivers medications and can also be used for blood tests. And that line itself can be infected, and that could lead to other conditions, things like that. Another example is surgical site infection. So after a surgery, where the surgery was performed can become infected. So unfortunately, there's a lot of different infections that can happen. And if a patient has an infection, they could also develop sepsis. So sepsis is a life-threatening condition when the body's immune response to an infection overreacts and sends all of these sort of like chemicals and things like that that can actually lead to widespread increased inflammation, potentially organ damage, and it can be life-threatening. So sepsis is something that is actually very common in hospitals too, because a lot of patients may have infections, and that infection can then lead to sepsis. And with sepsis, it's very important to detect it early because then it can be treated with antibiotics or whatever therapy is appropriate for that patient. So thinking about sepsis, there's actually algorithms that are used in the electronic health record that can more early detect sepsis than maybe a doctor or nurse can based on different information from the electronic health record. This is something that has been deployed in healthcare. The big EHR companies such as Epic have these algorithms available for use in hospitals. The hospital I worked at used it. So I got an early sort of view of how well these algorithms work. So let's watch this video to get a sense of how this AI works for early detection of sepsis.
Number 9, AI for early detection of sepsis. Considered a global health crisis, sepsis claims a life every 2.8 seconds. Early diagnosis is critical, but can be complicated because symptoms are common among other conditions. Now, artificial intelligence, or AI, has surfaced as a new predictive tool to help rapidly detect sepsis. Using AI algorithms, the tool detects several key risk factors in real time by monitoring patients' electronic medical records as physicians input information. It then flags high-risk patients, enabling early intervention, which can improve outcomes, lower healthcare costs, and save lives.
All right, so that's just a high-level introduction to these sepsis algorithms, but these have been deployed really across many hospitals in the US and I'm sure across the world. Now, there have been some challenges, though, with these sepsis algorithms, especially during the early part of their rollout. So Epic is a major electronic health record software company. I would say over 50% of hospitals in the US use Epic. And when they rolled out the sepsis algorithms, they found that it alarmed more often than it needed to. And what they found was that maybe this model wasn't as accurate as it could be because it wasn't necessarily trained on the best data or the most representative data for all populations across the US. And it actually turned out that this model was trained on a limited amount of patients from maybe 3 or 4 hospitals when it was initially rolled out. And that may have been why it was triggering these alerts too often and maybe wasn't the most accurate model. So what Epic did then is they decided to work with each of their hospital clients and retrain the model based on their data. So each hospital has a proprietary algorithm that's based on the populations that they see. Because one algorithm's predictive ability for a certain set of patients may be really, really dependent on the patients that see that the doctors at that hospital. So the accuracy of the model, how biased that data is really matters when you're thinking about deploying these AI applications. And that kind of brings me to the final part of this talk, and this is about ethical concerns. So when you think about healthcare, well, when you think about healthcare, healthcare is already a very, it's a very human practice, right? Doctors and different healthcare professionals are treating other people for their medical issues, their diseases, and they're taking a lot of risks in doing that. And sometimes there can be errors. So there's already ethical issues in healthcare without AI. Now we bring in AI. And some of these, there's even more concerns potentially, and these have to be considered before you're just going to deploy AI across healthcare. So this came from the paper we did, the umbrella review. So in addition to tracking data types and applications, we also tracked the author's report of ethical concerns. And in each paper, we just sort of flagged it yes or no if the author did report ethical concerns. And an interesting part of this data showed that basically from 2021 through 2024, that was like the end of our data collection, the proportion of ethical concerns that were flagged as a yes by the authors gradually increase. And you could see in 2024, that's the highest proportion of authors reporting that they did have ethical concerns about the rollout of AI in healthcare, which I think makes sense, right? Because AI has gotten a lot more powerful in the recent years. There's more interest about it, but then there's also concerns like, is it safe, right? Is it accurate? Is it biased? Is it explainable? All these things are very relevant because in healthcare, like I said, there's already a lot of ethical concerns and safety risks and things like that. So making sure the model is also pressure tested with all these different ethical concerns is really important. If we can condense the different ethical concerns in AI and healthcare into four main buckets, there's data privacy. So this looks at like, all of this data is used to train algorithms, right? But that data comes from patients, right? And are the patients okay if their data, even if it's de-identified, are they okay with it being used to train models? And they have no idea how it's being used, and it may be used for commercial purposes, things like that. So, and then if there is a data breach, are those different patients' data, is it protected, right? So there's a lot of data privacy concerns with all of this data that's being used to train AI models. The next is bias, right? Is the data that's being used to train the model representative of the entire population? Are we thinking about all the different patients, the demographics, and all of the scenarios that may be important for that model to be as accurate as possible? And then the algorithm itself, right? There's a lot of different models that you can use to make predictions, right? Were all of those different models considered, or did you only use a few models that maybe have limitations or weaknesses, right? So there's a lot of potential bias with the data that feeds these models and the models themselves. The next is model inaccuracy, right? The performance of these models, the ability of these models to make accurate predictions may not be 100%. Like usually nothing is that accurate. But is it accurate enough to say that it's better than a human, or it can be used with a human to then make medical decision making? Or is it prone to hallucinations like we know large language models can be, right? Is that a big enough risk where you really can't deploy this model in a real world healthcare context because the risks are too big? The last thing is explainability. All right, with more basic models and algorithms, we can probably have a better sense of what predictors went into a specific output, right? What with other more sophisticated models that are called unsupervised learning, like neural networks, things like that, where you don't necessarily have an output that you're targeting, you're just letting the model kind of find patterns, it may be harder to explain how this model works. And that can put a physician or healthcare professional in a difficult spot because if the patient asks them, how does this work? The doctor may not have a great answer, and that may not instill a lot of confidence in the patient, but also the doctor themselves, right? They may be reluctant to put all of their confidence into a model that they don't know how it works. So that's another reason why literacy is important and understanding the limitations and benefits of these models. So to end with, I think the one of the key features of addressing how ethical concerns is what has been called the human AI human or HAIH approach. And what that says is that the human should always be in the loop, right? AI starts with human inquiry and human curiosity, and then it also ends with human reflection, human insight, human empowerment to know that we know the benefits, we know the limitations of this, and we're still helping, we're still taking the lead on making this decision, right? AI is not necessarily making the decision for us. It has to be this interaction. So I think that's a good way to look at AI right now in healthcare, is that it's still early stage, but there are some really promising applications that are coming out. But the human always has to be in the loop, whether that be the doctor, the data scientist, the ethicist, the policymaker, or a combination of all those people. They all have to be working with AI to make sure it's safe, right? All right, so I'll leave it there. Now I could open it up for any questions that you all may have.